Somewhere in America, right now, someone is about to learn the hard way that snakes don't care about your plans for the day. About 7,000 to 8,000 people get bitten by a venomous snake in the US every single year. And what you do in the next few minutes can be the difference between a great story at Thanksgiving and a really bad week. Picture this. You're stacking firewood, minding your own business, and you reach into the pile for one more log. Sudden, sharp pain. 2 tiny puncture marks. And within minutes, your hand starts swelling like it's auditioning for a cartoon. In the next few minutes, we'll review how to spot a venomous snake before it spots you, what snake venom actually does to your body, the warning signs that things are getting serious, the snakebite myths that could actually make things worse, and exactly what happens when you walk into the emergency department with a snakebite. Quick note before we dive in, I'm a board-certified emergency medicine physician, and this channel is all about translating what I see every day in the ER into plain English. No jargon, just the stuff you actually need to know. If that sounds like something you'd find helpful, please like this video and subscribe. Before we get into venom and puncture wounds, let's talk about spotting trouble from a safe distance, because most of us probably don't know how to differentiate a venomous snake from a harmless one. Most venomous snakes in the US are pit vipers, and they tend to share a few tells. Look for a triangular, almost spade-shaped head that's noticeably wider than the neck, pupils that look like a cat's, vertical slits instead of round circles, and a thick, heavy-looking body. Rattlesnakes obviously have the rattle, but copperheads and cottonmouths don't, so the head shape and eyes are your better clues. Now, coral snakes play by a different set of rules. Round head, round pupils, smooth scales, and red, yellow, and black bands. There's an old rhyme that helps with this one. Red on yellow, kill a fellow. Red on black, friend of Jack. It's all about which colors are touching each other. On a coral snake, the red bands touch the yellow bands. On a look-alike, like the harmless scarlet king snake, the red touches black instead. Here's the honest bottom line though. From a distance, in real life, with adrenaline going, color rhymes are a fun party trick, not a safety plan. If you're not 100% sure, treat it like it's dangerous and just back away. Nobody has ever regretted giving a snake more personal space. So now that we know who the usual suspects are, let's talk about what happens after the bite. And here's the part nobody tells you at summer camp. Not every snake bite means you actually got venom. Some bites are what we call dry bites. The snake strikes, but delivers little or no venom. Great news, right? Except here's the catch. There is no way to know that in the moment. So if a snake bites you, you treat it seriously until proven otherwise, because symptoms can show up or get dramatically worse over the next several hours. Let's talk about what pit viper venom actually does once it's in there. It's not just, ouch, that hurts, it actually attacks tissue and small blood vessels directly, which is why you see that dramatic swelling, bruising, and sometimes blistering spreading up the limb. It can also mess with your blood's ability to clot. So in more severe cases, people can develop vomiting, weakness, dangerously low blood pressure, abnormal bleeding, or even neurologic symptoms. This is why just wait it out at home and see is not a strategy. It's a gamble, and venom doesn't care how tough you are. Now here's where it gets sneaky. Coral snake bites are the con artists of the snake world. The bite itself might barely hurt, minimal swelling, you might genuinely think that wasn't so bad. And that is exactly the problem, because the neurologic symptoms can be delayed for hours. We're talking drooping eyelids, double vision, slurred speech, muscle weakness, even trouble swallowing or breathing, showing up long after the bite happened, when the adrenaline's worn off and you've almost convinced yourself you're fine. Think about that for a second. A bite that looks like nothing could still be the one that needs the fastest care. That's the whole reason wait and see is such a dangerous plan with any venomous snake bite. Before I get into what actually happens once you get to the emergency department, let's put a stop to some myths that have genuinely made snake bites worse for decades. No tourniquets, no cutting the wound open, no sucking out the venom Western movie style, no packing it on ice. every single one of these fixes you've heard about, they don't work, and some of them actively make the injury worse by cutting off blood flow or damaging tissue that's already stressed enough. So here's what you actually do step by step. Number 1, get away from the snake. You don't need a rematch. You don't try to catch it, kill it, or identify it up close. It's already won. Number 2, call 911 or your local emergency number immediately. Don't drive yourself if you can avoid it, because venom can cause dizziness, weakness, or even loss of consciousness, and a car is a really bad place for that to happen. Number 3, stay calm and limit movement. I know that sounds impossible when you're panicking, but keeping the bitten limb still in a neutral position, roughly around the heart level, actually helps slow the spread. Number 4, take off rings, watches, and tight clothes near the bite now, before the swelling makes it impossible later. Trust me, cutting a wedding ring off later is a whole other emergency department visit. Number 5, gently wash the area with soap and water and cover it loosely with a clean, dry dressing. And number 6, if you can safely snap a photo of the snake from a distance, great. It might help, but it's never worth risking a second bite for a better picture. Poison control can help guide you, but that call should never delay getting to emergency care. Now picture our woodpile patient walking through the ED doors. Here's what's actually happening behind the scenes. First, we run through the basics: airway, breathing, circulation. Get them on a monitor, start an IV, and treat the pain and nausea because venom is genuinely miserable to experience. We'll also check whether they need a tetanus update, because nobody needs 2 problems at once. Then we start tracking the venom. We literally draw a line on the skin at the leading edge of the swelling and measure it repeatedly, because if that line keeps creeping up the arm, that tells us the venom is still active and spreading. We'll also run blood work, blood counts, clotting studies, fibrinogen, kidney function, because venom can quietly mess with your blood's ability to clot even before you feel it. In most cases, we're on the phone with poison control or a medical toxicologist, because these folks live and breathe snake envenomation. If things progress, worsening swelling, abnormal bleeding or clotting labs, low blood pressure, weakness, or neurologic symptoms, that's when antivenom comes into play. Modern antivenoms like Crofab are FDA approved and can neutralize the venom that's still circulating in the bloodstream, stopping further damage in its tracks. Here's the brutal truth though. Antivenom stops the ongoing damage, but it can't undo injury that's already happened. That's exactly why getting to the ED early matters so much. And because symptoms, especially clotting problems or that sneaky coral snake neurotoxicity, can show up or come back later, patients often stick around for observation longer than they expect. Not because we're being cautious for fun, but because your body's clotting system might still be working through it hours later. The good news is that most venomous snake bites are very treatable when people get the right care quickly. That woodpile isn't going anywhere, and neither is your backyard, but a little respect for what's living in it goes a long way. Drop a comment. Have you ever come face to face with a venomous snake? What did you do? If this video helped you feel more prepared, go ahead and like it, subscribe, and send it to someone who spends a lot of time outdoors. They'll thank you later, ideally without ever testing it firsthand. As always, stay prepared, not scared.